Hi there, I'm Felicity Hill from Midmed. Today we're going to be looking at our new Enfit range of enteral feeding solutions. In 2006, following several incidents of misconnections within the clinical setting, the international organisation GEDSA was formed, the Global Enteral Devices Supplier Association, consisting of healthcare professionals, specialists, clinicians and manufacturers. The main purpose of this organisation was to develop an enteral-specific locking system which would decrease the opportunity for misconnections to occur. After years of research and development, a male-to-female locking system was developed. As it is now recognised by the International Organisation for Standardisation, it's imperative that Australian health facilities incorporate Enfit into their practice. I'm going to be giving an overview of Enfit and its components, and then most importantly look at the key clinical implications in your workplace when it comes to using Enfit. This presentation will cover feeding tubes, syringes, sampling devices and their use in drawing up medications, accessories, and transition adapters. To keep it simple, all lines coming from the body, including nasogastric tubes, gastric tubes, low-profile extension sets and J-tubes, have a male Enfit port, and all external incoming lines, including pump sets, gravity sets, extension tubing, syringes and other bolus feed devices, have a female Enfit port. This diagram shows what is currently in use versus the new Enfit connector. There is a large range of gastric tubing available through Midmed. All our nasogastric tubes have a closed, rounded tip with 2 to 4 lateral opposite openings, radio-opaque stripes for X-ray visualisation and placement confirmation. The tubes are colour-coded to easily identify the tube French gauge size and have markings every centimetre. Midmed's nasogastric tubes are available as weighted, non-weighted and with or without a guide wire. Within the paediatric range, there are short-term 24 to 48-hour PVC gastric tubes, as well as longer-term 45-day polyurethane tubes. The neonates and paediatric tube range is available from 4 to 10 French gauge size and between 40 and 125 centimetres in length. The adult range offers 90-day polyurethane tubing with a 6 to 20 French gauge choice and length of between 110 and 130 centimetres. Our Midmed Enfit syringes come in a range of sizes. They can be purchased as 14-day home use syringes or as single use in clinical settings. These syringes vary in size from 1 to 60 mils. They can be used to administer enteral solutions such as milk, enteral medication, to flush, hydrate and bolus feed. They can either have a centred or off-centred tip for use with pump and feeding devices. The Enfit female syringes are available in 2 tip versions, the low dose and standard dose. The standard Enfit tip is used on most syringe sizes. The low dose tip was developed to address clinicians' concerns about dosing accuracy when delivering small medication volumes. Due to the design of the Enfit syringe tip, the manufacturer recommends capping syringes once filled. Washing instructions are available with our 14-day reusable syringe range. To ensure precise dosing administration, when drawing up liquids to be given enterally, either a sampling straw or fitted bottle cap should be used. When using the attached bottle cap, attach the syringe to the bottle adapter. Turn the medication bottle upside down and quickly cycle up and down to remove any air bubbles. Pull the plunger back to desired dose. Turn the bottle right side up and remove the syringe. Move to the patient and connect the female Enfit connector of the syringe to the male Enfit connector at the patient's side and administer. When using the medication straw, firstly connect to the syringe. Then insert the straw directly into the bottle, pull the plunger back to desired dose, quickly cycle up and down as previously. Disconnect the straw from the syringe and gently tap to remove any remaining medication. To administer, move to the patient and connect the female Enfit connector of the syringe to the male Enfit connector at the patient's side. The design of the Enfit connector ensures there is no dead space, as the tip of the syringe is filled with the matched Enfit connector from the patient. When transporting medication, ensure a cap is fitted to the syringe. Because ENFIT is not one specific manufacturer, there are transitional adapters available to ensure that until all enteral feeding lines are ENFIT compatible, ENFIT can be used with non-compatible tubes. The key points to take from this training is that you must use the drawing up devices when drawing liquids into an ENFIT syringe. This ensures accuracy of the dose. It is best practice to cap your ENFIT syringes once filled. If you require further information, please feel free to contact us.